for joining to let us know?
Yes, please.
Because I think folks are trickling in.
I'm sorry?
I said, I guess I'll wait for Jordan to let me know. Is it doing anything?
Yeah, I just want to make sure we're good. It should be good. And we're
Are you
I'm gonna unmute you, but I don't think the stream won't actually start for it.
Okay. The post-lunch crew.
We're going to be away from.
Yeah.
We're going to try.
Yeah, okay.
I'm just came to the front.
No, it'll be good. We'll keep it lively as our food and lunch digest.
That was a lot of bread, too.
A lot of bread. Hello and welcome. You know, move this out. Love folks sitting in the front with me. I love it. Come on in. And as I mentioned to folks coming in, if and when possible, try to connect your cell to the strong Wi-Fi for the meeting. We're going to try to have some interactive polling, so I just want to make sure that in advance, if you're in a strong network and be able to connect when we get to those sections. Okay, perfect. So I have the green light. It looks like we have everyone. Thank you so much for choosing to join my session today. This is the part of the education day where we slowly move away from some of those technical skills that is part of being an advocate, and hopefully you find some tips in here to how you then apply that as you leave the session. So this is influential leadership skills in healthcare and life sciences. So I'm not sure how many of you are aware, but you hear the term life sciences once you kind of step out of that institutional hospital setting. So pharmaceuticals, biotechnology, especially in the consulting world, will use the term life sciences. So it could interchange, but just wanted to flag that in case we had folks that were in industry within our session. My name is Saran Traore. I am the founder of Elevate, which is a leadership coaching and development firm. And I stepped into this. Prior to that, I've spent about 10 years from hospital to pharmaceutical to consulting within healthcare and life sciences. So the goal today, and especially for my firm, is as I've worked with folks and developed within our industry, I found that I really found my passion in those power skills, what makes us great at what we do on the patient advocacy and the patient access side. And so I decided that really that's what I wanted to branch out in, and founded Elevate specifically around developing sustainable leadership habits so that as you progress in your career, these are skills that are second nature to you. Okay? So today's objective, as I mentioned, I'm hoping and my goal is today that we interact as much as possible. So to my comment earlier and to our folks that are on the live stream, please go to menti.com, and this is the code that we'll be using throughout the presentation to just get you all as involved as possible as we're talking about specific approaches and skill sets for leadership. And you'll see this code again, so don't feel that after this slide, so I'll try to peek that as we go through. You'll see a little heart on each slide. If we're talking about something that interests you or sparks a little reaction, it's always great to see that. So you'll have a heart within Menti to just check on some of the content that's really resonating for you. So again, as I mentioned, I know this is post-launch, so we'll try to make it as interactive as possible. Our session goal today is really understanding why influence matters. Regardless of where you are within your organization, whether you're entry, mid, or at a leadership position, it's really understanding why it matters within healthcare and life sciences. We'll touch on some principles. Again, this is a process, it's a journey. When we talk about sustainability, it's about consistency. So what are you doing post every day to really tap into some of these tips when you're heading into those high stake engagements? And then of course, I'll share some approaches. We'll focus mainly on high stake engagements because normal everyday conversation, you may find those opportunities to influence, but we're really going around those engagements that you really want to prepare for because there's a desired outcome that you may be heading into. So we'll kind of close on to talk about how you can apply some of these principles and skill sets that we'll go over today. Okay? And if there are any questions as we go through, please let me know. So you guys have learned a lot today, from contracting to prior auth and so forth. So this is our first engagement, just stepping out a little bit from our technical skills. So head into Menti and tell us if it's the apocalypse, right? What skill set do you offer in a survival group? I'd like to see some of those words come in. Okay, I see leadership and innovating. All right. No one said hunting yet, right? Loving this. Okay. I love what I'm seeing so far. No two skill sets seem to be repeated yet, which is great, right? Because you're looking for a bit of diversity when you're in a survival group. So I see communication, innovation, logical reasoning. We're definitely in the right place with our healthcare setting. No, great. So thank you for sharing that because, and I see more coming in. This is great. And the concept of this, although light a bit, it's where is it?
Coconut engineering.
I love it. My survival plan is that my friend, I call her Pioneer Woman. I will go find her and she will help me live, right? But we'll talk a little bit about transferable skills. A lot of the times, because healthcare, clinical, medical, it's very specific, but we forget that we bring things to the table that brings value and can really augment a team. So this is a light way of sharing that you should look at your skill sets in a broader sense beyond the technical and tactical skills that you bring to a team. So thank you for participating. So I'd like to start with a quote from Dale Carnegie. When it comes to influence, I love his school of thought, his book, How to Win Friends and Influence. Every time I open that book, I pull a nugget. But basically, the key concept is the only way on earth to influence other people is to talk about what they want and show them how to get it. As we progress through our session today, you'll find that we keep coming back to this. A lot of the times we head into conversations about what we want, what we're looking to get out of it. When in reality, if we take a step back and look at what our stakeholder is potentially looking for, what their motivators are, you'll find that you get closer to your desired outcome. He uses a great analogy in that, tell me I'll ask you guys, what's your favorite food?
Chicken, and more chicken.
Chicken, and more chicken. I heard someone say sushi, right? Just the two people that spoke up is two different things. When you're going fishing, do you bring sushi or chicken to the fish?
Yeah.
You do? You want to. What is the fish looking for, right? What does the fish want when you're going fishing? Bait, correct? So it's that concept of if you're going fishing, why would you bring only what you like when the fish is looking for something else? Ultimately, that's what this is saying. And for every high-stake engagement, what we'll go through today is this concept of taking a step back, remembering this quote, and then working backwards from that. Okay, give me a little heart. Yeah, I see a few hearts. So as we're going through, if something resonates and you like it, please go into Menti and let me know if that's resonating. Thank you. I'm seeing a few of those hearts. So just taking a step back, I mentioned earlier around my experience prior to stepping into pharma or healthcare. And it's really how in each of these roles, the concept of advocacy, I found that when I've applied certain concepts of knowing that influence matters, it's where I started to find my stride and find success. So started in nonprofit, right? Getting folks to understand that it isn't just about the conflict of what we were trying to bring awareness to in the Congo, but it was the concept of the power of the consumer. And I started to realize that once you went the route of the masses and what they care about, which is their cell phones, right? And that if you're purchasing cell phones from companies that are potentially pushing that conflict over, it wasn't resonating to the public until we started to link it to something that was important to them, which is the cobalt in their cell phones, right? And then I head into Johns Hopkins, and how many of you work with HCAP scores or CAP scores in some level in your, yeah. So I had the wonderful role of linking clinical staff, non-clinical staff, patients, in why these surveys were important, how they're linked to quality measures, how they're linked to reimbursement, but at the same time helping the clinical staff manage patients that aren't, let's be honest, aren't always on board with what needs to happen. And I had to realize that just stating that these surveys were important was not enough. Why we're here was not enough. So how do I influence each of these stakeholders to bring us to a place where we could move our scores, but also that our patients with every inpatient and discharge felt like they were being cared for. So of course, AstraZeneca, I've had a few of my old customers in here today. It's been great connecting with folks. But as a field reimbursement manager, it's really all you're doing. You're bringing awareness to your organization's drugs, but you're also advocating for you all because you became a source of insight and feedback to how these programs got better. But when you get that call of a screaming physician saying that the patient's delayed or that they're underpaid or that the claims were denied, it's not enough to say that that's the insurance's job. So how do I bring them back to the table? And ultimately, I found that that's the part that I loved. So just some context that as we go through, it's really tying it back to what this means for you all when you go to your day-to-day and engaging with your stakeholders of how you can take these influential skills and make it applicable across patients, providers, and your multidisciplinary teams. So we're going to be all about being present, not just today, but the next couple of days as you stop by the Career Center. So I'd like for everyone to just take a minute and think of a scenario based on what we've kind of touched on already. Now, you can either think of a scenario where you were looking to influence someone or someone came to you asking for something, right? Now, did you get what you wanted? Whether you were the one driving the conversation or something was being asked of you, do you feel like what you needed was addressed? And if it was successful or not successful, why not? And the reason walking through a scenario in this manner helps is because at the end of the day, when you sit through those high stake conversations, someone is being influenced. If it's not you, you are trying to get someone there. And so that level of awareness as you're having these discussions is why as we're going through again, it's really being present and thinking back to one of those engagements and what that looked like. Thank you for the hearts. I'm just really loving that. And so let's shift this back to your day-to-day. We're going to go back to Menti. For those of you that have it open, we'll give you a few minutes. As an advocate, whether you're community, hospital-based, think about it. Who are your main stakeholders? Try to narrow it down to a day. And let's really just see, and if there are any others, I might just call in a few folks. All right. Very internally heavy.
I have a question.
Yes, ma'am.
On a given day, as
Mm-hmm.
an advocate, as an independent advocate, all of these are my main stakeholders. All of these here, but you don't have any of this stuff.
For multiple, yeah, we're trying. So think of the question as just narrowing the stakeholder that you have in one day the most. So select the one that you would have the most interaction with. Because I know you all, in an hour, you could have probably spoken to several of these folks. But for the sake of the discussion today, try to narrow it down to a group set. No, thank you. Thanks for that clarification. Okay, so from our teams both here and virtually, we're seeing that certainly patients and caregivers are at our 55%, and then of course your internal teams. And so from the medical team, from administration to your multidisciplinary, you all talk to a lot of people that need and want different things almost within the hour. And definitely understandable the level of mindset switches that you have to do in a day to have those discussions. It's not easy, right? So just more of an illustration to the fact that the more you're practicing these skill sets and the processes and approaches that we talk about, the concept is how do you create a process that works for you, understanding that no matter what, you're having these influential conversations on a daily basis. So thank you for participating, for sure. And so as we talk to those key pieces, I have some examples here of where influence or what are some of those high stake engagements could potentially look like within healthcare and life sciences. And this can be applied to potentially different sites of cares. So especially in big health systems, there's always an initiative. If it's not quality measures, it's patient safety, there's always something that is taking place. And usually as either a lead of a department or part of a team, you may want to lead that initiative, but it's not always obvious that maybe you should be, or you just haven't rallied the right folks around to be the lead of an initiative. This tends to, how many people have at some point or another in their career as an advocate has wanted to lead and felt that they were the right person to lead an initiative within their, show of hands, I see you there. Yep, so you've had these conversations, you'll probably continue to have them as healthcare evolves, right? You need to inspire more people to believe in something. Back to my example at Johns Hopkins, I needed folks to believe in the HCAP scores. Although they probably added more to their day-to-day, I had to find ways to really inspire folks and be enthused about something that's not so easy. But I'm sure across your clinics, we talked about contracting today, you're constantly looking for ways to get people more involved and enthused about something that may have come top down or bottom up or whatever it may be. I need to improve my leadership presence. If you're looking to move up in the organization, it's possible that at one point or another, this is a statement. Some may say improve executive presence. I use the term leadership presence because the concept of executive presence, by the time you get there, if you've built consistent leadership skills, by the time you get there, that executive presence, which I define that as confidence in conveying your message, you're already there. But likely at some point, I've heard it through my career, I need to improve my leadership presence. I'm not sure where to start, right? And of course, I don't have the right network. You may have an initiative, you may have a way to cut costs or improve patient outcomes, but you may not just have the right change agents or the right network or relationship to really bring this forward. And how to navigate that through an influential approach or in high stake engagement are ways that you can apply some of these concepts within healthcare. If there are any questions, again, as we progress, please raise your hand. And so we did the exercise a little earlier, and thank you for mentioning that you do speak to a lot of these stakeholders multiple and different ways within a day. The diagram on my left is just to, again, illustrate in healthcare and life sciences, on some level of not, you've either worked in one of these sectors, you interact with someone from these sectors, or you need something from someone within this diagram. And in the right is just a simple illustration that in a day, if you're an advocate, you can go from the plan to the patient and caregiver to the team, and you're looking to get them towards something. Again, this is a lot. It can be a lot, and everyone's looking for something different. right? So how do I consistently get to a point where I have a desired outcome, but if I don't have that desired outcome, do I have a process to quickly calibrate and figure out how to get there? And again, a few hearts I see. If anything's resonating, please don't forget to engage. And so we segue into the 5 key principles of influence that we'll be going over today. You'll likely, as you get into more of these, you'll see other principles that are out there. There are other school of thoughts, but usually they'll center around one of these 5. We talked about our earlier starting point, which is that you need to understand that everyone, not just you, we all have our own reasons. And so if you're starting a conversation and only thinking about yours, it isn't necessarily about the other stakeholder, but you may be setting yourself up for some roadblocks. So always remember that as a first principle, just remembering that people have their own reasons for what they do, why they do it, and that's probably what they care about most. Okay? Balancing ego, results, and relationships. Our egos are real. When we believe, especially we're a passionate group of people, right? And ego is not necessarily a bad thing at every point, but we have to remember that it exists. And because we're so passionate and we believe in what we want, sometimes our egos can blind us to ways to move the conversation over. So there's that concept of balancing your ego and results. And you'll see we get into the concept of guarantees. They talked about it earlier today in some of your key sessions, whether that's negotiation, reimbursement, contracting. Results may not happen in that first few sessions or those first few meetings, but you have to manage those expectations. And then, of course, your relationships, they matter. Who you know sometimes is very important to what you're trying to get to. That's not a bad thing. It's reality. You work in huge systems that require that. And so make sure that as you're heading into these conversations, a key principle is just balancing these 3 as you're prepping for it. Ask for what you want.
Yep.
Ask for what you want, right? You can build it in a nice value proposition. If any of my marketing folks are in here from pharma, what is your value prop? But that value prop has to include what you want. So a clear messaging. That's okay. Doesn't make you a bad person, but just you have to say it. It has to be clear. Your impact is your impact. You can't control what that other person's going to say. You can't control what that other person's going to do, but you need to get comfortable in the fact that your impact is 100% your responsibility. So there's some accountability there and some minds. We're back to ego, right? Because our ego can tell us that's not me, that's not mine, right? So kind of keeping all of that together. And at the end of the day, there are no guarantees. If you're going and depending on another person for a desired outcome, you have to have that level set and understand that there may not be a guarantee. You can be as prepared as possible, but just keep that in mind and be kind to yourself that you're prepping as much as possible and it just may not happen on that first try. I see some hearts there. Thank you. So we'll build off of these 5 principles as we get into now the applicability of things. I want to make sure there's room for questions as well as we're progressing. So if anything comes up, or if you have a question, a thought, I come from the world of coaching. So even if it's not necessarily a question, but it's eliciting a certain emotion, that's okay to share here too. Okay? All right. So this is, the Mentee code is there for anyone that may have to refresh. Just know that it's always there if you want to participate. And so before we head into approaches, one key thing, as I mentioned earlier around preparation, is really leading into this. How are you really going to be clear about asking for what you want if you don't know the goal? You have to spend time figuring out in a single meeting, if I am going into a meeting, what am I looking to achieve? You've got to take the time to do this. Make sure that it's very clear, right? We've written SMART goals. We've heard it over and over again. It applies here. Know what you're actually going into. And again, be kind to yourself that this is a first meeting. This is not an end-all be-all. I know we're in patience. Sometimes it is. When that prior auth call is coming through, it has to happen in that first meeting for sure. But again, that's where the concept of setting a goal matters, because if it's like by the time I get off this call, my appeal will be overturned, or I'll have a next steps for my provider. Just know what that is, right? And prep for your objections. You guys know your peers, you know your patients, you know your doctors, you know your administration. So if I think this is going to be the objections that I get, it's okay you should prep for that, because you can still pivot the conversation accordingly. Understand the situation. We've talked about ego. I'll keep coming back to ego. Distrust any first impressions you may have. I know what this person's going to say. I know this is how they're going. Challenge yourself to just step out of that mindset, because it will blind you from true preparation. It likely will. And so we do this in coaching, where you do rehearse. What do you think? What does that sound like? Get it off your chest. And now let's take a realistic step back on what may potentially happen. Okay? And this is not, I know sometimes influence is linked to manipulation, or some people might say you're making people do things that they don't. We've already dispelled that, right? But one key thing in understanding the situation is, if you know your situation, you'll know what's in your control. Sometimes it's something that you need to take away, right? There's value that you're bringing to the table. Or it could be that if I hit the messaging around saving money or whatever it may be, you will know what you can offer or what you can take away. So take the time when you're understanding the situation to know, because it can be a negotiation. Are you prepared for that conversation? So that's really what we mean about know what's in your control that you can give and what you can take away. And last but not least, try to understand the other person. I feel like now I'd hope that I keep drilling that in, because it's super important. How are you going to know what you're going to take away if you don't understand what the other person's motivations are? What do you share in common? It's realistic that sometimes even when we talk to payers and we're trying to move things along, there is that common ground of patient access and making sure that you're going to find something that links. So what is the common goal? Because then when you're choosing your approach, you'll be able to really build that in and leverage that as you progress in the discussion. And then, yeah, get them excited. That's okay. If you're happy and enthused about what you want to share that. But sometimes people don't receive things as you do. But what gets them excited? What's going to get them so moved to your vision to say, you know what, I'm good. Let's go. Let's move forward with your idea. And so it's really important that before you choose an approach, which we'll progress into, that you make an effort to be really present in these three categories before you then select an approach for your engagement. All right, so drilling a bit more down into that first section. So I call it the DO, or the desired outcome, because you can have a goal, but then in that first meeting, what do I want to walk away from? Do I want a second meeting? Do I want other stakeholders? Or do I just want you to say yes? What is your desired outcome? Okay? And if that outcome is that my stakeholders could be, I want them in either one or all of these, that's going to be important for your approach. So you want them to agree intellectually. You have an idea, maybe patient outcomes or quality value based, that's really data driven and insights, and intellectually you want them to see the value. Know that, correct? Or you just want them to be excited or compelled by your idea. You know, this is a great idea. I want to learn more about it. I want more time. That could be a state of desired outcome as well. Comply. Whether they're committed or not. As much as we want to influence people to get to do things because they're excited about it, you all may have roles where people just have to do it. They just have to do it. So sometimes you're heading into a conversation where I just need you to comply. And if that's the case, what's your ammunition? How are you prepared to get through that conversation? So that's really what we mean in that comply, whether you're committed or not, I need you to comply. Know that, okay? Sometimes it's that, yes, I'm aligned. You know what? Let me help you on this project. I love it so much. I want to jump on and make this part of my development. That could be. So it's okay to have a desired outcome where you want a person in one, maybe more of these, but again, be realistic of what you can accomplish in one setting and one meeting. Okay? And always flexibility. Thank you for the hearts. Any thoughts? I want to check into the audience. I see some nodding, but anything to add or the applicability of this in your day to day? I like the heart. Yes.
So with the compliance, in my case, usually it's the patient who's non-compliant. So what would be the best tool you would think of to help? I mean, I explain to them how it will help them financially to comply with what I'm asking, but sometimes, lead a horse to water. So are there any tricks that would help with that?
Exactly. No, I've I've been in those conversations, or along with when the doctor or the nurse and everyone's kind of having some form of an intervention for that patient. And I think sometimes the pitfalls is that we go in thinking that if we have the data and the impact on their health of what this is doing, that that's somehow going to shift this I worked on infectious disease for years, and we all have those frequent flyers. They're told several times what could happen that could land them in the ED, yet every month we see them back. And I wouldn't say that there's a trick per se, but we forget that our patients are people too, and there could be other reasons why that's preventing this person from shifting their behavior, because your health, it's a behavioral shift, right? So repeatedly maybe sharing the data of the impact of how that's impacting you for that patient may not be their motivator. And so one of the things at Hopkins that we used to attempt to do, and I know we were a bit lucky to have the staff to do this, in addition to the social worker, we had she was a nurse, but she was more so there to spend that additional time with patients, getting to know them. What does home life look like? What can we do? Because then when she was part of the discussions with providers, she gave that additional messaging where they had someone they trusted. We understood the patient's situation a bit more, where the ask was presented a bit differently than just, if you don't do this, you're going to die. So it's not a trick. There's no one way of doing this. You all know your stakeholders, and we know how hard it is for patients. But my process has always been, we forget that we're dealing with people that have their mindsets and their behaviors for years. I've had patients tell a nurse, you're asking me to stop quitting. I see you on your break smoking when I'm coming to the hospital. Yes, it's not fair, but that patient's taking that in and discrediting everything that you're saying. Not to say that it's her fault, but we have to be aware of that they will use that to not do what they don't want to do. So I don't know if that answers your question, but it's more about you need to know the situation and the patient and the population to know how to deliver the ask, and it can't be a repeated copy and paste because it may not change the behavior.
Well, and sometimes it might be there, are we looking at finances? Are we looking at depression? Are we looking at, are they young and have children? Are they old and have parents? What are the socioeconomic circumstances to why they may or may not be participating? And I feel like as healthcare providers, we have a tendency to overlook that because we look at all the data and we come in and we're the know-it-alls, ego, right? And we know what to do and how to do it, but we're forgetting that not everybody is, in that same arena.
And that's a good point, because I've heard the complaint. You guys were strapped for time. And that's why I said that we were a bit lucky to have someone that had that role. But in reality, sometimes to your point, the data is all I have time to pull to have this discussion with the patient, right? And so that's why I say we have to be kind to ourselves and to those we're talking to, because you never know what that situation is, and making the assumption that it should just move forward the way I want it.
And maybe that's something that you should add into your scripting when you're sitting there with your patient and you go over the finances and they're still kind of on the fence about what they want to do. Are the finance part of it not what you're worried about? What else is going on in your life that is making you hesitant to want to move forward with this? Opening up the conversations where they feel comfortable with telling you those things is going to be a big key.
And that's where coaching, I know Michelle, my colleague back there, is smiling. Powerful questions they open doors in ways that you wouldn't even imagine. Sometimes we walk in, we look at the data, I know this patient situation, and I go in. Instead, to Jordan's point, sometimes when you ask key questions, the patient will lead you to the answer of what needs to happen to get them where you need them to be. So it's practice, right? These are skill sets that you have to keep applying as much as possible. But usually I've done it in the field with my customers. I don't come in with the next portal or the next code. I'll ask you, what are your barriers? Tell me what your day looks like. What's preventing these? And usually the answer is sitting in the question. I feel like I'm coding a movie, but they might lead you there if you don't want to go on some long investigation. Just listen to them. So those are all, I hope that helps in some of the tips as well.
And I know when you're talking to a patient, if they're talking and you're listening with an empathetic ear, you'll pick up on clues and tips a lot better and a lot more than if you're just sitting there going, yeah, 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 yeah. Sometimes you, as the person they're talking to, you have to shut it down and listen. Listening is a very important skill when it comes to reaching and making sure that your patient and all the other stakeholders, their thoughts and ideas are getting heard, understood, and acted on.
And that matters with our internal teams as well. Right? And so listening and all of that, it's practice. You have to keep applying it so that it becomes as consistent as possible, but knowing that you're going to experience setbacks. So great discussion on that, because I think as you experience it every day. These, again, I mentioned these are processes that we can attempt to apply as we progress. And so we'll head into now, and you all have touched on a few of these, your desired outcome, right? And now we'll talk about some approaches or some attempts that you can put in place to just help guide that conversation in these high-stake engagements. And so if you're looking to inspire and enthuse your stakeholder in that single meeting, you've done your research, you're trying to figure out what motivates this person, you're likely looking at the right brain, right? The spirit and the vision. What's common for us? What are we trying to accomplish? That vision piece. You're going to need to, and no, does this work with my stakeholder, right? And so your right brain, spirit, and vision approach is really that part that makes that we concept, what we're trying to do. What does our collective vision and common ground look like? Because then that will get them excited and enthused. They get, that feeling you get when you solve something for a patient and it's been going on for so long and you get that approval, you're just like grinning, right? You're trying to get them there. And so some of the approaches, and we do this in coaching and so forth with time restraint, we can't really go into every single one of these, but think about it in that way that you're trying to touch on their spirit and that vision of that person to get them inspired. If I just want to convince you, and a lot of the times based on your stakeholder, you mentioned data. They just want to know, how much is this going to cost me? How much is it going to save me? What does our patient data look like? Why should I even care about this? That's your left brain, folks. And if you're going into a meeting and this is someone that's completely left brain and you're only right, who are your resources? Who can I tap on to really help me pull this part of my message? It doesn't all have to be you, because the reality is you're probably working and talking to folks that may be better suited for some of these conversations or to come in with you. So I just want to make sure that that's also clear, that it doesn't have to be you all the time with each of these approaches. And so your left brain is likely they're looking for reason. But don't discount adding a little bit of that enthusiasm and that right brain to get them, you're doing something to save a life. You're impacting patients. That's okay to put in, even if you're talking to someone that only cares about the hardcore data. So again, that fluidity and flexibility, it's okay to kind of compound some of these together. So comply, we were just talking a little bit around that. Now, if you're talking to your team internally where you just need them to do, sometimes it's an assertion. This is what needs to be done. How do we get there? Back to those questions. How do I help you, or how do we support each other to get there? But at the end of the day, it's really important that they understand that this is something that has to be done. And then you can carry your message and add other items in there where it's a collective effort. Now, if it's a patient, you can't exactly force a patient, right? And so negotiation may be the term that goes in there. When you learn a little bit more about what may be preventing them from doing what you need them to do, you start to negotiate. Well, and I've seen doctors, they do this. Well, if you can't be on all of these medication at once, how do we get to a point where it's balanced for quality of life for it is a negotiation sometimes at the end of the day. So keeping in mind that compliant isn't always just do it, but it's a point of negotiation to what makes sense and motivates both parties. And then, of course, you want folks to commit. You always come back to the heart, right? And this is where you all mentioned it, the asking questions, the listening, right? Where can we be flexible in that negotiate and really finding that common ground of the we matters, because sometimes you're looking for them to, you want to convince them, but I also want you to commit to this. Not just say yes and then 6 months go by and I don't have your commitment to keep this going. You may need to add this on to certain desired outcomes. I see some hearts coming in. If this is resonating, please let us know. And ultimately, as I've mentioned, when you align your desired outcome, you'll be able to choose the appropriate approach and how do I prepare for that conversation. Any questions or thoughts as we're going through, please feel free. And so we're back to a little bit more of our mentee engagement. So we just talked about those 4 desired outcomes, whether it's comply, commit. Rank for me, if possible, which do you believe is most challenging in healthcare or life sciences out of these 4 desired outcomes, if you could rank them from 1 to 4.
Yeah, she said the most challenging.
And this can look very different based on where you sit, where you are, even if same systems. All right, we see some movement. Commit. So showing we have 8 people, more people joining. We'll give it a few. I'm really interested in, because Michelle, I have a feeling this may come up in the next 2 days. Yeah. Looks like commit is. And this can be across stakeholders. It doesn't have to be your internal team. It can include your patients, your caregivers. Just which do you find tends to be the hardest? Okay, we have about 21 people that's voted, but it looks like commit has really, anyone want to share anything specifically about that? Because that's different than complying, right? What do you find to be hard about commitment?
My specific job is to help with the financial aspect,
Mm-hmm.
and I can convince them that it's gonna help them, but I have to get them to commit to bring me back all of the documentation. You know, we get so far, they're really excited when I leave my office. A week later, I call, you got your W-2s, did you get me an invoice from the pharmacy?
Oh.
And it's, well, this came up, that came up, there's no time to do this or that.
Yeah.
So that's one of the most difficult pieces for me, is I need all of that paperwork to make an effective case to anybody trying to get funding for them.
Yeah, no, thank you. So I'm remembering that our live stream folks may not be able to hear you. So I asked, what about commit makes it one of the hardest things? So you can get someone to comply to something, and I think the comment back was it's that level, basically the accountability after. So if you're looking for them to commit, it's that follow-up of what are your next steps, and when you check into those next steps, sometimes you find that that hasn't taken place for one reason or another. And I think that's real across the board, even personally, professionally, right? Folks, I'm going to do that, but it's after, have we done it? 3 months, 6 months? What does that look like? Fair point, for sure. Okay, so now let's put it all together. We talked a little bit more about, level setting yourself and that level of your ego, your expectations, and then your stakeholders, the level of understanding that needs to happen. So let's put it all together. I see some hearts coming in. So before the engagement, just really summarizing, right? You need to know either the person or the situation. And that could be internal or external. What's going to impact that desired outcome? You then choose your approach, because if you go in right brain for a person that only wants to see numbers and you have nothing to pull out and show that, you may have set yourself up a little bit for failure, because then that's 30 minutes to an hour with that person not having what they were really looking for. Prepare for setbacks. We touched on this a little bit, but one of the approaches that we haven't really touched on here, and we do this either in coaching or if you have mentors, it's really, what does your argument have legs? Does it have legs to stand on? And if there are true objections and you see the meeting going awry the first 15 minutes, how are you going to redirect that? If the setbacks are completely new, you should be prepared for someone just right off the bat saying no, or how are you going to salvage that? So that's one of the things, as much as possible, be prepared if to close that argument, or maybe just repurpose the meeting if needed. Rehearse. I'm a true believer in this, in safe spaces. Sometimes you want to vent your frustration with how something's not working. And if you go into that meeting without having gotten rid of all of that, it might show up in front of your stakeholder. So it's okay to just say all the stuff and probably not nice things that need to be said. Then you can go in just with a clear mind and say what you need to say and really manage your emotions if you hear something that may set you off a little bit. And then during the engagement, we talked to being genuine is important. And I think that's what separates manipulation from influence. You're not there trying to finagle something out of someone, right? Like, you're honest about what you want to accomplish. So just head in without promising things that you're not going to do. Just be honest and as genuine as possible. So it's okay to be friendly before you ask for something. They know you're probably there to ask for something. Just give them 5 minutes of catching up. That's okay to begin friendly. Okay? Someone mentioned, you mentioned listening, right? Talk less. Ask as many questions, because you're prepared for everything, but it's possible that they may get you to step 10 before the meeting is even to a close. So you want to ask those open-ended questions that gets the person to tell you what they need, so that you're applying the right arguments to this. So try to talk as less as possible. And of course, we've talked about the common ground and the shared value. And if cooperation is really that outcome, suggestions get you way more than just telling someone we have to. You can tell someone we'll save lives today, and if they feel like you're just telling them what to do, the walls go up and they're just in defensive mode, and at that point, nobody's getting really any value out of that. And so if you put these two together as advocates and the approach, it's the desired access outcome. Okay, I see some hearts there. Thank you. So I wanted to take some time and talk about now what after my engagement. So I've done my preparation. I've gone in and set my expectations for one meeting. I may have a follow-up meeting potentially, whatever that may be. But it's so important to debrief, especially when you've had a high-stake engagement. Your mentors can come in here, any trusted advisors that you have, because this is the moment of honesty. What did I do well? What didn't work well? What should I do next time? You've got to create an environment for you where you can hear the feedback that's going to get you to success. And sometimes a way to do that is to really debrief the engagement and maybe pull it apart, especially if you didn't fully get what you wanted in that first meeting. So debriefs are super, super important. And someone mentioned the commitment part, right? Your accountability, because there's accountability for you as well. Or what you want to do is get that person to keep their word. And so how do you make it actionable? They say, you know what, let's set up another meeting next quarter and see progress. Well, how are you keeping yourself accountable to ensure that you do take that meeting, you do take that spot, and you move things along? So the concept of making it actionable and staying committed isn't only for the other person, but it's also for you, especially when you're the one that wants to drive the outcome and the change. All right. So before I go into where we might be able to have you guys stop by the Career Center and what's next, are there any questions, thoughts? Yes, Jordan.
So in the listening part, I'm really glad that you touched base on that, because I have a hard time with like actively listening to people, and one of my versus a leader, and she will tell you that I will listen to her, but I will not hear her. And so, yeah.
Gonna go back here. For the folks on, this is really what, yeah.
If you kind of, like, body language goes into that a lot of, if I face towards you with, like, openness, and I look at you and I can hear you, that's gonna sink in much, much deeper than what I often do to Bree, and I'll just be typing and listening to her, things like that.
So multitasking.
That engagement and actually actively listening is really helpful for me, and it's hard to try to remember to do, but it definitely makes a difference.
No, thank you for sharing that, Jordan. And it's really being present, right? Because again, you all are busy people. You probably have 5 things to do that most people need to do. In 5 minutes, you need to do double that when most people just have one task potentially. And it's hard to not multitask when you're having conversations or someone needs you to listen to them. And so thank you for sharing that, because listening, talking less and listening, it's not just the act of I've stopped talking, but how present am I in what I'm hearing from the other person. And again, it's okay to repeat back what you heard, because it'll probably save you from going down the wrong path, only for the person to come back and say, but that's not what I needed, right? So thank you for sharing that. Yes.
I actually would like to commend her for actually
The
saying
self-awareness.
what she just said in front of the employee that works with her, right?
It.
We all
Yes.
learn how to do
We're
that.
clapping in the room. Thank you. I love that.
If we learn how to do that with both our internal stakeholders and our external stakeholders, we would be surprised at the kind of success that we would come out with. It's called being transparent.
Absolutely, absolutely. And there's a whole session that we can do on emotional intelligence. But to your point, Jordan had a moment of being self-aware, knowing what I could do better, and being vulnerable enough to share that with an employee in the room. I think we underestimate the power of that. So thank you so much for calling on that. Yes.
Vulnerability and transparency is why I follow her.
Oh, I am loving this right now. I am loving this. Because this is what it should be, right? As teammates, colleagues, bosses, to folks that, right? The concept of being a manager, it doesn't just have to be someone reporting to me. There is a way of building that trust. And for your employee to say, this is why I work for you, is the joys of leading people. So I love this, guys. Keep it going. Come on.
Just a comment, but I love it when I ramble, because I do. I can't help it. And somebody just asks me, stops me and says, I'm sorry, what was the question? I love that. To be the person who asks that is my goal.
Yeah, no, I believe Dave's back. I've worked with a few folks here, and I'll be the first one to say, I'm gonna ask a question. It's clear in there somewhere. Bear with me as I get there. But again, self-awareness, because I know that I can. And to your point, I have a goal to maybe flip that a bit. So a lot of this, you'll find that as you're going through the process of understanding the other person and figuring out how to engage them, you learn things about yourself. And then you're like, oh, wait, but I've been told that I do that, or maybe I should. All of a sudden you start to do, and that's why this is a process. It's not something you're going to jump out of here today. You're probably even going to forget some of the pieces that we've all talked about, but that's the concept and process of rehearsing, having that safe space. It doesn't mean anything bad. We all do it. I rehearse, I practice. When I want to have conversations that are meaningful and that are high, I do it. And so, do it. So we talked about debrief. So with that said, Michelle Cabell is in the room today. She's my fellow coach. We are super excited. The Healthcare Advocacy Summit has asked us to run the Career Development Center. So during the exhibit tomorrow and Friday, and in your book, you'll see a page that talks about turning insights into action. And that's beyond just this session. You all are taking and learning so much this week. And I mean, things that you already know, things that are newer to you, things that you would like to learn more about. our goal is to help you all with that accountability of, if I'm learning it and I'm that interested in it, what am I going to do after these 3 days? So towards the back of this guide, and it's also online, if you go into the Career Development Center, you'll find that there's a page by session to just have you answer a few questions to keep them fresh in your mind and how to then make it actionable. So stop by our booth. We have a few sessions. We have some group coaching going on. We have an hour-long workshop on actually developing a career vision and why that's important for your long-term growth. So wanted to just make sure that we're calling that out to you all. It's in your toolkit. And Thursday and Friday, you can find Michelle and I at the exhibit where we can either talk more about influence, emotional. She's DISC certified if you're interested in that. So just come network and see what questions we can answer for you. I saw a hand raised.
Well, so, and it's fine, a lot of what you're talking about to me feels very hospital or institutional based. And being an independent patient advocate, what I'd like to see is how you turn some of this towards that. And so, for example, I just literally took a phone call of a client in rehab, and they want to discharge him on Friday, and I didn't know I was going to be here and he was going to be in the hospital, and I said it needs to be Saturday.
Yep.
And they're suggesting either a SNF or assisted living. He lives in independent. I said, if you're doing that, then you can justify one more day until he has somebody there to help him. And that's where I'm going. And they're like, no. And I said, then send me the appeal papers because I know Medicare will approve it.
Right.
If you're already recommending a higher level of care. So that's the kind of stuff that independent advocates deal with. And to me, it's not a matter of influencing them or getting them to agree with me. It's a matter of it's absolutely unsafe for this patient to be discharged and he'll end up right back in the ER. Do you know what I'm saying?
I
So
do.
that's a real life application to like, how do I mean, it took me everything to be so calm with that gentleman on the phone.
And so to that question, and yes, some of and most of the examples from a healthcare, because technically even as an independent, you're doing a bit of,
hospital, yes.
correct. Now, I will ask them that question. You know that this is for patient safety.
Yes.
Wouldn't maybe some level of influence to get the other person on the phone to understand the
And
importance
exactly
of that?
what
And so I love this example because one key thing that I'll mention, and you'll find that Michelle and I will talk a lot about this, whether it's our skill sets, whether it's things that we learn or we hear, healthcare to me, it's one of the most transferable things that I have ever experienced. I wanted to be a diplomat, okay? I wanted to go and represent my countries and whatever it may be. But what I found, the more I worked in healthcare, you're negotiating. You're coming to the table with someone else's interests. So I say that because what you all do on a day-to-day basis, the skills that it takes to do that is not only what I do in my hospital or as an independent advocate, as a consultant, ex-pharma, but I'm taking how I do that and applying it to the situation that I see. And so as you look at some of what we shared today, try to just take a step back and think, well, if I'm looking to understand this other person, what does that look like in this scenario? And it's that continuous practice of that and applying it when it comes that it becomes so second nature that then you're talking about sustainable habits. So I'm actually glad you brought that up because Melissa and the team, we talk about that all the time. I'm like, man, I wish people could see that you have like golden skill sets that most people in other industries wouldn't even begin to know how to apply that. So it's stepping into that empowerment is a little bit as well. I know we have 5 minutes. Are there any other questions? Because the next few slides is just going to be a little bit more around Elevate, but I'm loving the discussions. Any other thoughts, comments, questions? Yes.
Are there any measurement tools for what? I identify that the best advocates on my teams are the ones that are experts at the content, but also at portions of this. Like I'm realizing this is intuitively part of what they do that makes them better than their peers.
Yes.
Is there any way to quantify that or to help encourage that with me?
I'm looking at Michelle because, yes, certainly. we call, people call them different things: soft skills, social skills, power skills. But at the end of the day, there are assessments out there in the workplace in demonstration. One key thing that my approach to assessments, it's not to say I'm emotionally intelligent or I'm data driven, but how am I showing and demonstrating the competencies on a day-to-day that makes me successful. So I'm just gonna pop over here because so workplace assessments are a way to do that. And you can do that as a team, or you can do it as individual leaders and build development plans and visions and goals as a team to say, this is what we're committing to beyond our tactical skills or strategic skills in the job, but also that competency piece of these social and power skills. And Michelle and I can talk a little bit more about what this represents. You've heard about verbal. It's almost like when you do your 360s with your employees, you're technically looking at how they do the job, how, internally as a team, how you're collaborating with the team. But these are a way to actually measure how often people move from unproductive to productive states. So, more than happy to talk to you about what that looks like. Michelle and I would love to do that. This wraps this session. Please stop by and see me to continue. Thank you all so much for participating. I had a great time with you all.
That's great, thank you.
Okay, now I can eat my food sandwich. I looked at it and I was like, I'm going to be falling asleep if I eat this.
I know Chris did too.